Congratulations on your pregnancy. As you may know, women have many choices available to them to learn about the health of their baby during pregnancy. However, it can be difficult to choose which option is best for you. We created this video to review the different conditions that can be tested for during pregnancy and explain the testing options so you can make the best decision for you and your baby. The options we will discuss test for certain abnormalities in the baby. We will first review what these abnormalities are and how they could affect the baby. As we learn about these abnormalities, keep in mind that most babies are born healthy. The chance for any birth defect in a baby is approximately 2 to 3%, meaning that the vast majority of babies will not have a birth defect. Birth defects can be caused by many different factors, including chromosome abnormalities. To understand what is a chromosome abnormality, we will first review chromosomes. The human body is made up of trillions of cells. Each cell contains 46 chromosomes. Chromosomes contain genetic instructions called genes that tell our bodies how to develop and function. Chromosomes come in pairs. For your baby, one chromosome from each pair came from the mother's egg and one came from the father's sperm. Therefore, usually the egg and sperm each give 23 chromosomes to the first cell of the baby. It is important for the baby to have the correct number of chromosomes to develop properly. The chromosomes from one cell, as seen under a microscope, are shown here. Occasionally, an egg or a sperm can accidentally give the wrong number of chromosomes to the baby. In these situations, the baby has an extra or missing chromosome in each cell and is said to have a chromosome abnormality. Most chromosome abnormalities occur by chance or randomly, but as a mother becomes older, her chance of having a baby with a chromosome abnormality increases. Even so, most babies, regardless of the mother's age, are healthy and do not have a chromosome abnormality. The most common chromosome abnormality causes Down syndrome. Down syndrome is caused by an extra copy of chromosome number 21 in each cell. People with Down syndrome have mild to moderate intellectual disabilities and typical facial features. About half of people with Down syndrome have a heart defect, such as a hole in the heart, and some can have other health concerns, such as vision or hearing difficulties. Less common chromosome abnormalities are called trisomy 13 and trisomy 18, which are caused by an extra copy of chromosome number 13 or 18 in each cell. Babies with trisomy 13 or 18 are often miscarried. Those that survive the pregnancy have severe intellectual disabilities and various birth defects, including heart defects. Most babies with trisomy 13 or 18 do not live past 1 year of age, but some may survive for several years or more. Down syndrome, trisomy 13, and trisomy 18 are some of the chromosome abnormalities that can be screened for by the testing options we are about to discuss. The testing options will also screen for other specific birth defects, which we will now review. One type of birth defect that can be detected by some prenatal tests is called a neural tube defect. A neural tube defect is a problem in the formation of the baby's spine or head that occurs in about 1 in 1,000 babies. One type of neural tube defect is called spina bifida, which may cause paralysis and can sometimes cause other complications, such as lack of bladder and bowel control. Another type of birth defect that can be detected by some prenatal tests is a defect of the abdomen or belly. These defects occur in about 1 in 2,000 babies. Usually, these can be corrected after birth, and in many cases, the baby is healthy after the surgery. Now let's review the different tests that can detect the conditions we just learned about. There are two main types of prenatal tests. First are screening tests. Screening tests estimate the chance of certain abnormalities in the baby. The results will say whether the baby has an increased chance or a decreased chance for certain abnormalities. However, screening tests cannot tell you for sure whether the baby has a problem. Some women wish to have a screening test first and then decide whether to proceed with additional testing depending upon the results of the screening test. There is no risk to the baby in performing a screening test. The second type of prenatal test is called a diagnostic test. Diagnostic tests can tell you for sure whether the baby has certain conditions. Therefore, they are more accurate than screening tests. However, diagnostic tests have a small risk for causing miscarriage. Let's go back and review the specific screening tests that are available. There are 3 different screening test options: ultrasound, the California Prenatal Screening Program, and non-invasive prenatal testing known as NIPT. First, we'll discuss ultrasound. Ultrasound uses sound waves through the mother's belly to create pictures of the baby. Between 11 and 13 weeks of pregnancy, ultrasound can be used to measure the nuchal translucency, which is a small pocket of fluid at the back of the baby's neck. A normal nuchal translucency measurement, as seen in the top picture, indicates a lower risk for a chromosome abnormality in the baby. A thicker nuchal translucency measurement, as seen in the bottom picture, indicates a higher risk for a chromosome abnormality. The best time to get a good view of the anatomy of the baby is at about 18 to 20 weeks of pregnancy. At this time, ultrasound can detect some birth defects, such as some cases of open spine defects, heart defects, and cleft lip. However, many types of birth defects cannot be detected by ultrasound, and ultrasound can never say for sure whether the baby has a chromosome abnormality or a genetic condition. The California Prenatal Screening Program is a test that screens for Down syndrome, trisomy 18, open spine and abdomen defects, and certain other rare conditions. This test uses a blood sample drawn from the mother in the first trimester between 10 to 13 weeks, combined with the nuchal translucency measurement to obtain a preliminary risk assessment for Down syndrome and trisomy 18. A second blood sample is drawn from the mother in the second trimester of pregnancy between 15 and 20 weeks to obtain a revised Down syndrome and trisomy 18 result, in addition to the chance for open spine and abdomen defects and certain other rare conditions. The most recent screening test available is called NIPT, or non-invasive prenatal testing. This test uses a blood sample drawn from the mother after 10 weeks of pregnancy to measure small amounts of the baby's chromosomes in the mother's blood. The test can determine the possibility that a baby may have Down syndrome, trisomy 13, or trisomy 18. Abnormalities involving the X and Y chromosomes may also be included in the test. NIPT is considered the most accurate screening test currently available for certain chromosome abnormalities, but it is not a diagnostic test. Some women choose to use the results of NIPT screening to decide whether to have a diagnostic test. Only a diagnostic test can tell for sure whether the baby has certain problems. Now, let's take a closer look at the diagnostic testing options. there are two diagnostic tests currently available: chorionic villus sampling, also called CVS, and amniocentesis. The earliest diagnostic test available is CVS, or chorionic villus sampling, which is performed at 11 to 13 weeks of pregnancy. To perform CVS, a specially trained doctor inserts a needle through the mother's abdomen or cervix and removes a small sample of tissue from the placenta. The chromosomes in the placental cells, which are usually identical to those of the baby, are then analyzed to determine whether the baby has a chromosome abnormality. Other tests may be performed depending upon the reason for the CVS. CVS may lead to miscarriage in about 1 in every 100 to 300 women who have the test. Amniocentesis is the most common diagnostic test and is usually performed at 15 to 20 weeks of pregnancy. During amniocentesis, a specially trained doctor inserts a needle through the mother's abdomen and withdraws a sample of amniotic fluid, which is the fluid that surrounds the baby. In the fluid are skin cells that have normally fallen off of the baby. The chromosomes in those skin cells are then analyzed to determine with high accuracy whether the baby has a chromosome abnormality. Other tests may be performed depending upon the reason for the amniocentesis. Unlike CVS, amniocentesis can also show if there is a higher chance of a neural tube defect or abdomen defect. Amniocentesis may lead to miscarriage in about 1 in every 300 to 500 women who have the test. Is there any way to determine for sure whether a baby will be completely healthy? Unfortunately, there is no test currently available that can guarantee that a baby is entirely healthy. Most cases of birth defects, genetic conditions, and intellectual disabilities cannot be detected by any kind of test currently available. However, the tests discussed in this video can help detect some of the most common conditions. And remember that most babies will be born healthy. For those interested in having more information regarding the tests we reviewed, or would like information regarding the chance of specific birth defects or genetic conditions occurring in their offspring, a genetic evaluation can be considered. During this appointment, a genetic counselor will review your family history to see whether you are at risk for certain conditions and to help determine which tests you could consider based on your family history. Your pregnancy history will also be reviewed to see whether you are at risk for pregnancy complications and to help plan the best care for you and your baby. If you have any questions about testing options or your family or your pregnancy histories, be sure to ask your doctor or the genetic counselor. We want to make sure that you understand your options and make the decisions that are best for you. We wish you well on your pregnancy journey.